A lot of people think public health and they think traditional safety net services and clinical and immunizations and TB, and while all those things are very important, when you think about public health the next and how can you do it differently and how can you do it in a new generation and a new set of environments with technology and other things, I think public health is how can you really mold your interventions that are traditional and based on evidence, along with technology, along with doing things differently, and customize it to the people that you're serving.
Public health is all of the activities that we do behind the scenes in order to ensure the health and well-being of a community like ours. But public health is behind the scenes, the invisible workforce, the offensive line of a football team that every single day is doing its job.
Phi Lab was birthed out of the success of the 1115 waiver projects, able to then take 77% of the dollars and reinvest them into innovative new projects for the health department that are going to move us forward into Public Health 3.0 and not move us backwards into Public Health 1.0.
Phi Lab was created to precisely address healthcare challenges and remove obstacles and barriers in an innovative way so that we could better reach to the community. We accomplish this by supporting, developing, and accelerating research-driven concepts and innovations into new initiatives.
The idea for Phi Labs really came from the fact that the waiver was designed to transform the community. And in that waiver, they give you what's called an incentive payment. The incentive payment is to continue the work in the community to really change the narrative about what health is. And so when we looked at what we were going to accumulate with those incentives for dollars, we said, how can we best transform the community and then use the concepts that were used during Disrupt to perform with metrics, to use data on how you do it, and to rethink how public health is delivered to those great ideas. Put those two things together and you have Phi Labs.
Phi Lab stands for Public Health Innovations Lab, and it is a collaborative space, but it's also an accelerator program.
The goal of an accelerator is to help an early stage company do roughly 2 years of business building in just a few months. Accelerator programs usually have a set time frame in which individual companies spend anywhere from a few weeks to a few months, working with a group of mentors to build out their business and avoid problems along the way. Companies are given a small seed investment and access to a larger purpose-driven mentor network. A typical accelerator has shared space in a co-working environment and some connection to the local community. In a nutshell, accelerators offer a great opportunity to help young companies and ideas progress in the right direction.
I like the idea of taking from startup accelerators and something that's for-profit, but applying it to public health practice.
We do this through education, mentorship, and financing. This is the first accelerator in the state of Texas that's solely focused on public health. Ultimately, our hope is to enable public health practitioners to benefit from the several tools that Phi Lab provides in collaboration with its innovation partners to design and create the public health of tomorrow.
The value of Phi Labs is the ability to multiply a small investment into a really big gain. If you look at things that were done in the Disrupt world like VDOT, where we took traditional direct observation therapy and turned it on its head and made it video-based, made it less resource constrained, made it more convenient for the constituent or the citizen that's out in the public. Phi Labs will bring that thing to multiple other areas.
And we're very proud of the work that we do, but we also want to recognize that oftentimes when we do our job, it's largely invisible. And we have to raise the visibility of our work. And that's why we're so excited about Phi Lab, getting out there and ensuring that our community is healthy, safe, protected, and yes, the healthiest community that it can be.
And Public Health Innovation Lab gives us this opportunity to figure out how do we cross all of these sectors and how do we make sure that we are addressing the social, the financial, and the health concerns and outcomes of all these communities.
Learning how to think differently, how to embrace technology, how to engage community members in ways that they haven't done before. You take all those things together, which what we know our employees have, which is passion, and you put that out into the community and good things are really going to happen.
We see Phi Lab as a platform that allows people to come together with a common aim to make a difference in the world of public health. Our mission is to bring a social impact at the grassroots level, ultimately serving those in need to make this world a better place so people live a healthier and joyful lives.